So this is today's, I'm going to talk about my presentation in 4 parts. First of all, I will introduce the SPR, and then I will talk about the principle of SPR a little bit, and then its application on drug discovery, and also the SPR service we offer in Eurofins Penn Lab Taipei, Taiwan. SPR is all about binding. It's basically a technology to measure the binding. Okay, so it can measure the biosimilar biomolecular interaction with a broad affinity range from picomolar to millimolar. So it's a very broad range that we can measure using SPR. And it's also a gold standard method in FDA, ICH, EMA, and also NMPA and in China. And it's a real-time technology, and then it's also label-free. You don't need to label it with radioactive or fluorescence. It's a high sensitive and also low sample consumption. We can work in a wide range of biomolecular interaction. So we'll talk about the principle later. It's basically measure the mass of the change of mass on the surface for SPR chip surface. So anything with mass that you can measure. Okay, protein and low molecular weight compound and fragments, peptide, nucleic acid, carbohydrates, lipid and membrane associated molecules. So anything with a molecular weight, with a mass, you can measure. And you can get lots of information. So obviously you can get the affinity information, which is how strong it binds. So we usually present it as a KD. We'll show it later in details. And also kinetics, on rate, off rate, that how fast it binds, how fast it dissociates from the complex, from the target protein, and the specificity and screening. It can use, because it's a relative high throughput, it can use to be a screening tool, the single dose screening. It can do the competition to see if the two drugs, they compare with the same binding site. For the small molecule application, they can also work on the large molecule application as well. For example, the epitope binding, comparability, and then concentration measurement, the active concentration measurement in the sample. They can also, SPR can also detect that. This slide give you a overall view of the binding assay technology, the comparison of that. So there are a couple of famous binding assay technology. For example, microscale thermophoresis is called MST, right? And then very famous ITC. I think most of people are familiar with this one. And also BLI is also measure the binding. It's biolayer interferometry. And then also the SPR, surface plasmon resonance. Okay, so there are pros and cons for those technology. You can see that for the MST, you don't need to immobilize sample on the SPR chip on the chip surface, so it's in the solution. So that is an advantage, right? And then you can measure the complex mixtures such as cell lysate, serum, and detergents. And you also have a disadvantage of this one because it requires internal fluorescence or fluorescence labeling. So in other words, you have to label the protein or label the drug to be able to use this technology to measure the binding. And labeling by itself, one can argue that it may change the binding kinetics and binding affinity if you put a label on the molecule. And there's no kinetic information basically using this technology. And compared to SPR, obviously SPR is a label-free detection, and it's also a real-time data acquisition, and you can get the kinetics affinity very easily. And it has a semi-high throughput capability, so you can use it as for the screening for the large library. And it's very sensitive and reproducible. And also SPR by itself have its own disadvantage. The analysis of the SPR sensogram data is a bit difficult, so it requires specialized technician and senior researcher with experience to run this experiment. And then also one big problem is that to do SPR, you need to label one of the binding partner on the SPR chip. So it's not working in the solution for one of the partner. One of them have to be immobilized on the chip, and then you flow the other binding partner through in the solution phase. So that's one big disadvantage for the SPR. And BLI is very similar to SPR, except that because they don't have microfluidic system, so its advantage is that you can deal with a crude sample such as serum, cell lysate. SPR, you need relative purified protein so that you don't, and also clean sample so that you don't clog the microfluidic system. But BLI, the problem is that you have a low sensitivity. It's about 100-fold lower than the SPR. So it's also measured based on the molecular weight. If for the small molecule, you cannot do the BLI at all, and then the sensitivity for the large molecule, the signal to noise is not as good as well. And you also need to be immobilized the ligand, one of the binding partner to the surface chip. ITC, it measures it requires no modification of binding partner, so you don't need to labeling like MST. It can determine multiple thermodynamics binding parameters such as stoichiometry, and then binding entropy basically, actually. And if the disadvantage of ITC is that it requires large sample quantity, and then some platform limited to affinity, so it's very difficult. I mean, it's kind of indirect to measure the binding kinetics. Most of people use it to measure the affinity and also entropy. So that's an overview for the technology comparison for the binding. And today we are going to focus on the SPR binding technology. So SPR's application, you can, as I mentioned, that it can work with both large molecule, which is therapeutic antibody drug discovery, and also work on the small molecule, like chemical small molecule, less than 100 Dalton and drug. So in the large molecule, usually you can do the screening for a single dose because you have high throughput, so you can screen all those clones to see which clone have a higher signal, have larger amount of antibodies that and also strong that can bind to the antigen. And you can also do the kinetic screening. Not only you get single signal strength, you also get the whole sensogram to show you the kinetics of that specific clone. And once you determine a couple of clones, you can do the epitope binning to see whether those clones compare to each other. You can classify them, you can bin them into different classes that to know that where they bind on the antigen. And also after you've determined, you finalize the antibody, you humanize it, and then you can do the kinetic analysis to determine its affinity and also kinetics on ray and off ray. And for the mechanism of action, you can do it with Fc gamma binding, which is related to ADCC, ADCP. And also you can do it the C1q binding, which is related to CDC. And you can do it with FcRn binding. FcRn receptor is related to the IgG half-life. So how long the IgG, this antibody drug can last on the serum. It can as a surrogate and also indication for the PK analysis. And also you can measure the active concentration as I mentioned in the sample. Batch difference, you can do that as well using SPR. For the small molecule drug discovery, from the very beginning, the target research, you can validate the target to make sure the binding of the target and the drug, and also target and its own protein binding partner. You can use SPR to test the binding. And you can do the fragment-based library, which is a couple thousand, and you can use it as a secondary screening for the HTS, a couple of thousand screening. You can do it in a couple of days, very fast for the SPR. Hit-to-lead fragment expansion, you can use it to check the binding affinity and kinetics. Lead optimization as well, binding kinetics and structural kinetics relationship. You can use SPR to give you a very good information and fast information for the small molecule drug discovery and further development for the solubility, all those things. SPR can test the binding for the drug to the protein, the target protein. This slide shows you the principle of SPR. I mentioned earlier that SPRs measure the molecular weight, the mass of the binding on the surface. Basically, what we do is that you can see that here is the SPR chip, okay, and then there's a microfluidic channel inside of a SPR instrument, and we have to immobilize one of the binding partner we call ligand on the SPR chip. For example, this is maybe a diagram for the antibody, for example, immobilize on the chip, and then we flow. It's another binding partner, for example, antigen through the microfluidic channel. So if antigen binds to antibody, then there will be increase of the mass, increase of molecular weight on the surface of the SPR chip. So when the increase of the mass on the surface, it will change the refraction index. In the back side of the chip, the SPR instrument will have a light source that shoots the polarized light, and then we measure the total refraction. In the total refraction, there will be absorption, right? So this total refraction angle is depend on the refraction index of the surface. And as I mentioned, the refraction index of the surface is correlated to the mass of the surface. So when you have antigen binding, you increase the mass, you change the refraction index, and then you change the total refraction angle, absorption angle, and then you see the SPR instrument will convert this angle shift to its signal strength. So it's a little bit of like the light balance. If you have a change of the mass, then you have a change of signal of the SPR. So the more analyte binding on the surface to the antibody, the ligand, and then the higher the SPR signal. So this is the basic principle of the SPR. It measures the increase of the molecule on the binding bound on the surface, and then you can see that real time. Okay. So take-home message is that SPR response is directly proportional to the change in mass concentration close to the surface. So this is the typical SPR sensogram. We call it sensogram, not chromatogram, right? X-axis is the time. So we monitor it real time. For example, a typical binding time is probably about 10 minutes for one cycle. And Y-axis is the SPR signal. We call it resonance signal, and the unit is RU, resonance unit. Okay, so when you immobilize the antibody on the surface, for example, we call it immobilize ligand on the surface. The molecule immobilized on the chip is we call it ligand. The molecule that flows through the microfluidic channel in the solution, we call it analyte. So when you immobilize the ligand on the chip, then this is your baseline of the assay. And then we start to use the running buffer to equalize the baseline. When the baseline is very stable, then we switch the flow to sample, not running buffer only, the running buffer plus sample, right? So if you have sample flow through, you will gradually bind to the ligand if they have binding, right? The analyte will bind to the ligand on the surface. So you will stay on the surface. Then the increase of the surface mass, then you will see the increase of signal of SPR. Okay? So you have more ligand bind, you have more signal. Then eventually you will go into the steady state and saturate. After if the signal is saturated, then we switch the buffer from the sample to running buffer only. In this case, that there will be no more binding on the surface, and then anything bound on the surface, because in the soluble phase in the microfluidic solution, there is no analyte. So from the equilibrium point of view, anything bound on the surface ligand, it will start to release to the solution and then flow out. It will be flushed out. So you can see the direct slowly decrease of the surface molecule. The binding of analyte will slowly decrease because they will dissociate to the solution phase and then be flushed out. And you can wait until the signal going back to the surface, the baseline, or you can do the regeneration step that can fastly release the analyte from the ligand and then go back to the baseline. And the baseline will be ready for the next round of the SPR experiment. So basically, the SPR, you will see the association, and then you will see the dissociation, and then coming back to the baseline. And then if you add the regeneration phase, that will help you to facilitate to speed up the dissociation phase. And in the right side, you can see this is a simple model for one-to-one binding. Is that if you have ligand and analyte, and they will form the complex on the surface. Ligand is immobilized on the surface, and analyte follows through. They will bind to ligand, and then they will trap the analyte on the ligand, form the ligand-analyte complex on the surface of a SPR chip. And for this way of direction, we call it association, and then we use the association constant K small a. And then for this direction, it's also ongoing. For the complex, it will dissociate to the ligand and also free analyte. We call dissociation process. And then it's monitored by it's governed by the K small d, the K dissociation constant. Okay, so Ka, Kd, we also call it K on and K off. Is a kinetic constant, intrinsic kinetic constant related to this binding reaction. And the response we see is that the increase of this analyte bound on the surface, the increase of the complex formation. Okay, this is a principle of SPR and how do you interpret its sensogram. So if you, as I say, you flow one concentration of the analyte, you get one sensogram. If you flow with a different concentration analyte, you get a titration of sensogram. Then you can overlay it. And using all of those concentration overlay, all of those sensogram, you can fit it with to obtain the kinetic constant. In the middle part here, you can see this is a simple equation showing that if you get the kinetic constant K on and K off, which is K small a and K small d, if you divided the K off to K on, then you get the K capital D, which is affinity index. We call it equilibrium dissociation affinity dissociation constant. Okay, so this is a typical KD you see on the paper, that it shows how strong two complex bind. You can see usually go with micromolar, nanomolar, millimolar. You can see different kind of binding there. To get the kinetic constant, you have this overlay of the sensogram, and then you fit it with a model, the one-to-one binding model, the kinetic fitting. The black line here is a model fitting. You can see the model fits very well with the sensogram. And then from the model fitting, you can get the K on and K off, K association and K dissociation. Alternatively, if your sensogram is looking like this kind of sensogram, these two kind of sensogram, is a fast on and fast off, or maybe a little bit of fast on and then slow off. And then you can see a steady state part that the signal they stay constant after some time of the dissociation phase. In the dissociation phase, then you can take this value and plot the steady state affinity fitting, and then you can obtain the KD, which is half of the maximum of the binding. And that you can obtain you can get the KD as well using the steady state affinity fitting. So there's two ways to get the KD. One is using the steady state fitting, and the other one is using the kinetics fitting to get the K on and K off kinetic constant, and then you divide the K off to the K on, then you can get the KD as well. So this is how we usually do the affinity and kinetics measurement for the SPR. So depending on its binding characteristics, sometimes you see the sensogram like this, sometimes you see the sensogram like this, and then sometimes you see the sensogram like this. For this kind of sensogram, because you can see each of the sensogram doesn't reach the steady state, right? So you cannot use the steady state affinity fitting. You can only use the kinetic fitting to get the K on and K off, and then you do the calculation to get the KD. And for this kind of the sensogram, you can see the on and off rate is very fast. So sometimes it's depending on how fast it is. Sometimes if it exceeds the instrument limit, you can only use the affinity fitting, not the kinetics fitting. And then you can get the KD only. You cannot get the K on and K off. But if you see the sensogram like this one, then you can both fit the kinetics and then affinity. So you can get the kinetics constant, and also you can get the affinity constant as well, equilibrium dissociation constant as well. So when you see the SPR sensogram, then you'll try it. You'll try with different concentration and get the SPR sensogram, and then depending on what kind of sensogram it is, then you can get different kind of information, or maybe you can get both of the information, kinetics and affinity. So why do we need to know the kinetics? Usually, a lot of papers they measure affinity only, right? But kinetics is also actually very important. You can see that here. This is 4 different kind of sensogram, okay, and they have the same affinity. The KD is 100 nanomolar, 10 to the minus 7 molar. So it's very, it's kind of strong binding, okay. But for this 4 different kind of drug, they have a very different kind of on rate and off rate. You can see this fast on, and there's slow on, slow off, and fast on, fast off. Very different, but they all have the same affinity. So if you only get the affinity information, you cannot differentiate this for drug, right? So you don't have enough information to see that whether this drug have a different kind of kinetics behavior. And why this kinetic behavior is important? Because, for example, sometimes we want the drug to stay on the target longer time. For example, antibiotics. You want to stay longer time so that you have longer efficacies in the body, right? Once the drug fall off the protein, then it may get degraded by the liver, by the other protein in the serum. So you want the drug stay on the protein as long as possible. If that's your purpose, then you want to choose the one have a longer resonance time, which is small K off, that it stay on the target for a long time. That's why it's important. You need to know the kinetics. Even though these 4 drugs show the same affinity, but obviously this one is better as a drug candidate, because you can stay on the drug longer time than the other 3. Okay, and if, for example, if you want if your drug is sleeping tablet, you don't want the drug have a long-term effect. You want it to go off very quickly, and it go on very fast, and then go off very quickly. You don't want it to be, if you take the sleeping pill, you don't want to be dizzy all day or several days, right? You want the effect go off quickly. Then you might want to select the fast on, fast off kinetics. So again, it depends on, if you have this kinetic information, it's very helpful for you to select a good candidate that can match your biological function of the drug you want to do. This is why the reason that we need the kinetic information, and SPR is a powerful tool to get the kinetic information compared to the ITC and MST other technology. It gives you the kinetic information right from the sensorgram. Very quick and then very direct. So also depending on the model, if you have a strong, a powerful new SPR instrument, then you have a very high throughput. If you have a throughput high enough, then you can use it as a screening. For example, for a small molecule, right now for drug discovery, they do a drug screening called fragment screening. Okay, so fragment screening, fragment is defined as the molecules are less than 300 Dalton, and no molecule is about 300 to 1,000 Dalton, and antibody is 150K Dalton. So the molecule is very different. And as I say, the SPR, the signal of SPR is depend on the molecular weight. So, I mean, in the early years, the SPR instrument is not sensitive enough to detect the low molecular weight compound. So it's not applicable to do the fragment library screening. But right now, the SPR instrument has been improved, and it's become much more sensitive than previous model. So right now, it can be used to do the fragment library screening. This is an illustration for fragment library screening. First, you do the primary screening, which is single dose. You fix the concentration of the library, of the fragment library, which is probably 2,000, 3,000 fragments, a combination of those fragments. And then you screen single dose to see which one have a higher signal. And then when you select the higher signal, then you do the multiple dose to do the affinity titration to determine KD and K on K off rate. And then to make sure that those binding is real, you have dose dependent. And also in between, you can also do the competition assay. If you have reference compound, you know that it binds to specific target of your protein. And then you want to find a new drug that binds the same target as well, the same binding pocket as well for that reference compound. Then you can do the competition assay to make sure that the drug you screen, the drug candidate you find is binding in the right binding pocket. And this is the illustration of the strategy of the fragment library binding. And this is the graph you will get for the SPR doing the fragment library screening. Not only you can get this signal strength for each of the fragment, but each of fragment you also get the sensorgram. You can see that it's binding kinetics as well for each of the fragment. So you get multiple information from the SPR round. Here we do a little bit of introduction of how we do the competition assay. The SPR instrument we have, the Biacore AK+, they have a very smart module that can run the ABA injection that can be used for the competition assay. You can see that here is usually they first run a running buffer, and then they run the equalization step, run the solution A, which is the competitor molecule. Then in the association phase, you inject solution B. That's the competitor molecule plus the fragment or small molecule you want to test. Okay, and then you go into the dissociation phase. You switch to the solution A back, and that's only for the competitor solution. So as you can see that in the equalization phase, if your competitor your competitor should bind most of your binding pocket on the target protein, on the ligand, right? Most of your binding pocket has been filled with this competitor molecule. So if you're in the association phase, if your testing molecule is binding in the same pocket, you will not see any signal because the binding pocket already been filled. But if that molecule, small molecule, is binding in the different binding pocket, then you will see the increase of signal because it's binding in a different pocket, right? So it will not be inhibited by the equalization step. So from the signal strength, you will know that if your testing molecule is binding the same binding pocket with the competitor. So this is a very straightforward, very intuitive and qualitatively, and maybe quantitatively to determine that whether your small molecule is compete with your competitor molecule, the reference molecule. Okay. This is a very simple experimental design. We can use SPR to determine the competition of a two molecule. So the same thing can work for the large molecule as well. One of the very popular application is called epitope binding. Epitope is the region of antigen that interact with antibody. Okay, so when we do the large molecule antibody discovery, we find many antibody clones that bind to the antigen. But we want to know that those antibodies, they bind to the same part of antigen or they bind at a different part of antigen. So that's called epitope binding. So you can bind them. Some of them bind the same part of antigen and the other bind the same part of antigen, different part of antigen. Okay, so antigen binding can be complemented with knowledge about the epitope specificity. So you know the epitope of those antibody. And then whether the antibody are capable of asserting the desired biological effect. So maybe only the part of the only the antibodies that bind to specific part of antigen that have a biological effect that can do the inhibition. Right? If you're binding to the different part of the antigen, then probably it doesn't have any inhibition effect. So that's why you need to bind your antibody to make sure that you focus on the antibodies clones that actually bind in the right part of antigen. So epitope binding experiments serve to identify and bind together antibody with similar epitope specificity. So antibodies share with a shared and overlapping epitope may be candidates for the therapeutic use, right? If you bind in the right one, they can share similar the therapeutic functions. And then, but if they bind in the different part, then you know maybe their function is a little bit different. Okay, and then if they bind in the same epitope, you can also use as a sandwich ELISA candidate, like a tool antibody, if that's your purpose of the antibody discovery. And it can be used as IP protection. Maybe one part of the binding pocket of antigen has been patented. So you want to find antibody that binds to different pocket to avoid this pattern. Then it's important to know its binding pocket. So you need to do the epitope binding as well. Right hand side is the basic design of the epitope binding of antibody in the SPR. First, you immobilize the capture antibody that capture the Fc region. Then you capture the antibody 1, and then you block the antibody, block the rest of the capture antibody. Then you flow through the antigen. Then you flow through the antibody 2. So if antibody 2 is binding in the same position of antigen as antibody 1, then it cannot bind to the antigen. So if antibody 2 is binding in a different part of antigen, then as shown in the diagram, it can be bind on this antigen in this setup. Then you will see the increase of signal as well. So depending on the increased signal of antibody 1 and 2, you have increase or you don't have increase of signal, then you can bind the antibody to the different category. So this is called epitope binding. It's sort of the application of the competition as well, but it's specific for the large molecule. For example, here, you can see that you have 6 antibody. You can see that 1, 2, 1, 3, 5, 7, 8, 4. You have 8 antibody. 1, 3, 5, 7, 8, 4. Those antibodies, they bind to the same antigen. And then 2 and 6, they bind to the same part of antigen. They have two different classes of antibody. Even though you have 8 antibody, they only bind to the 2 different classes of antigen pocket. Next slide is a case study of what we have done. Another application is called surrogate potency. So SPR can be used as a potency surrogate, like a quick test for the potency. Usually potency, we test it with a cell-based assay in the drug discovery. But the cell-based assay is usually time and cost consuming. Sometimes cell-based assay takes a couple of days, sometimes even takes weeks, and may not be adequate during the cell culture, purification, and also formulation process. That you need the information very quick. Like if you change the cell culture parameter, you change the purification parameter, you change the formulation, you want to see the data very quick, right? In this case, using cell-based potency is not realistic because it takes probably a couple of days, even like many hours to get the data. So it's not very realistic that you cannot have the cell culture to hold for that long. So in this case, that the fast and simple SPR-based assay can be used as a surrogate assay to determine the relative potency of biological drug during the process development and then comparability study. From the A and B, there's 2 ways for the SPR application to do the potency assay. So it's surrogate potency. One, the A is that you can use the EC50. So relative EC50, then you can calculate the relative potency. And B, you can use the parallel line analysis. And relative to it's a slope and intercept, and it's intercept. And relative to your control, you can calculate its relative potency. And for these 2 experiments, we prepare 3 samples. One is 70% of optimal, and your control is 100% of optimal. And the other one is 130% of optimal. Then if you run the SPR potency assay, you can fit it with a 4-parameter EC50 model. And then you can calculate those samples. You can see that if you have a 130% of optimal sample, the relative potency we calculate through this SPR experiment is 132. It's pretty close to the 130 optimal sample. If you have only 30% of active optimal, then we get the SPR data is about 69.4, very close to the 70% we get. This data shows us that this surrogate potency for this optimal PD-1 system is a very good surrogate potency assay. That if, for example, if you have different batch of optimal, okay, one batch they have a higher active component. They have like 110, 120% of compared to your reference batch, which is 100%. Then you can use this SPR experiment to determine its surrogate potency very quickly. You don't need to wait several days for example, for the cell-based assay, or several hours even. This assay completes within 2 or 3 hours. Very quick assay. You can get the information of how good is this batch of optimal. And parallel analysis is the same. It's just different analysis to get the surrogate potency. Okay, so that's the SPR can be a potency assay, and it can be a QC release assay if you want to. It depends on the MOA, right? If the MOA is very much related to the binding, for example, optimal bind to the PD-1, then SPR will be a good choice as a potency assay. And you can also use it to do the biosimilarity. So right now, to claim the biosimilarity, it's important to demonstrate the comparative binding properties of originator, which is original drug, the approved biologic product, and biosimilar against the target protein. So it's important to compare its binding, and SPR measures binding, right? If you do it side by side with the originator and your biosimilar, you can compare its kinetics information, K on and K off. You can compare its affinity information with a KD, right? This is a 3 repeat of a 3 dependent experiment of both the originator Optivo, and also it's biosimilar. And you can SPR, you can generate this graph very easily to do this comparison as a biosimilar assessment. You can also, of course, compare its sensogram as well if you want to. Yeah. So it's a very powerful technique. So SPR provides a capability to measure the kinetic parameter of the binding property, and therefore is an essential and analytical tool in biosimilarity assessment. Next slide. Going back to the SPR, there are many instruments SPR. So right now, what we have in the Eurofins Pen Labs is Biacore AK+. This is a state-of-the-art model. Is one of the newest model of the Biacore. Biacore is a very big brand of actually the biggest brand of the SPR instrument. It's previously owned by GE. Right now, it's owned by Cytiva. Okay, and then Biacore AK Plus, the previous model is called T200. AK Plus have 8 channel. It can run 8 samples simultaneously. Total is 16 flow cell. Flow cell is like the microfluidic channel I mentioned previously in one run. So one run you can run 8 samples. It's much more efficient than the Biacore T200. T200 generally you run 2 samples. Maximally maybe 4 samples, but it's the data is not as accurate because you use only one reference channel. Okay, so you can see the new model AK Plus is much more efficient. And here in the bottom, it shows that we have 8 different kind of needles, the syringe that can draw sample from a 96 well plate or maybe 384 well plate. They draw sample there and then start the experiment. So here in the bottom, you can see that how fast it is, how efficient it is. For the binding level screening, only single dose, we can screen about 3,000 samples within 2 days, one to 2 days. Affinity screen is multiple concentration. We usually do 5 to 8 concentration, right? And then you can finish 4 samples for confirmation of a multiple dose titration experiment within 5 hours. So that's how powerful it is for the Biacore AK+. And it's also semi-automatic that you have a hotel here that can hold 6. They have 6 trays. Each tray hold 2 plates. Total, you can hold 12 plates. And each plate you can use the 384 plates, and also use 96 well plate. So you put your sample, you prepare a sample in the plate, and then you put it in the hotel, and they run it automatically overnight for you. And here is that this is just like a diagram to show that inside we have like a microfluidic flow cell, and IFC is detection, and you have your chip here. You have a light, your optical, the light component. That's what basically the Biacore AK Plus do. Then this is showing that the SPR service we offer in the Eurofins Pen Labs, Taipei, Taiwan. Many people, they do the FC panel, FC receptor binding for the large molecule antibody drug filing to the FDA or to the different agency. So we pre-developed this assay. We have a very complete assay with a different kind of variant, the major variant. Total, we have 9 variant, very complete binding panel here. You can order individual assay as well. Like if you are specifically interested in the FcRn receptor, you can order this receptor as well only. So very complete profile here. And then it has been pre-developed. So the turnaround time and also the fee is cheaper, and turnaround time is faster for this assay. And also C1Q related to CDC binding is also pre-developed. We have an item number here. You can see it on our website. And also we also try to develop some of the assay, the popular immune checkpoints, target PD-1, PD-L1, CTLA-4, CD8, already pre-developed. But of course, the binding partner is very different from the client. Every client Sometimes they want to try different kind of binding target protein. Some want to try kinase, some want to try GPCR, some want to try hydrogenase, different kind of the protein they want to do. We also offer the custom service as well for both large molecule antibody protein interaction, antibody antigen interaction, or small molecule like a fragment small molecule binding. We offer that service as well. Any target you would like, you can discuss with Coma, and then also maybe discuss with us, and then we can design the experiment, SPR experiment for you, custom design for you. So I think this is what I end here. And if you have any question, feel free to ask. Or if you, if I go over this slide too fast, you have you are not sure about the previous slide, you can let me know, and then I can go back to previous slide to explain a little bit more to you. Thank you very much, and then I'm happy to take any questions.